Good afternoon. Today's the 27th of March, and thank you for joining our live webcast. And tonight we're going to go through the format. First, I'll cover the current state of affairs. Eva, our county health officer, will cover the COVID-19 details, and John Lopp, our sheriff, will cover the shelter-in-place orders given by Governor Bullock. And then we'll open it up for some questions and try to answer any questions that we possibly can. And if there is something that we don't have the answer to, we will get the answer and get those back to you. So first off, with the current state of affairs. Our latest situation, on Wednesday afternoon, like we've covered, we had a clinic receptionist that tested positive for COVID-19. We have done a total of 5 tests during this whole COVID pandemic, and we have 1 positive thus far. So there's only 1 positive known COVID-19 patient in our county at this time. We have not tested anybody in the last 24 hours, so...
People are saying they can't hear.
It's very quiet.
Yeah.
Well, how come we could hear before?
I'll speak up. So that's part of the risk of going live. We'll try and get the volume up a little bit more. The risk factors for exposure is a high question that we've gotten. There's essentially 3 risk factors: high, medium, and low. High would be anybody that has been self-quarantined and tested already. So if you're not in that group, you do not have a high risk to exposure. Medium would be people who are also under a quarantine order, and those people have not been tested, but they're taking the precautions. A low risk factor doesn't mean your risk is 0, but it is low. So try to still take precautions, but we've heard a number of stories of, I passed this piece of paper to this person, and I saw this person 2 weeks ago. Your exposure may not be 0, but it is low. So rest assured, take a deep breath, and follow the orders of staying at home. Every patient in our clinic has been contacted by our director of nursing. So if you were not contacted, you were not in the window of exposure. So rest assured there as well. Testing is another issue or thing that we've had a number of questions on. As it stands today, we have 11 tests that we can administer to patients who will be symptomatic and have exposure. Not every patient that'll have symptoms will necessarily get a test, and not every person who has had exposure will get a test. You must have exposure and be symptomatic in order to get a test. There's precious few in our county, and we will test those as appropriate, but that will be up to our providers and following the CDC guidelines. We hope to get more tests. We've requested more tests, but so is every other county in the state. They're in high demand, short supply. So we are trying to get them. We've gotten some notification. We may get some more in the next week, but until we receive them, we have 11 in our county. Clinic and hospital operations. Today the clinic is closed and only open for telehealth visits. We're going to go with a modified clinic next week where we will have a priority list of patients to be seen in the clinic, and we'll have a provider available, and we will continue to use telehealth services. Partially to mitigate the exposure to our staff, because we have a smaller staff, but they're the ones who are going to be here to help you if you do come down with COVID-19. So we need to protect them to the best of our ability. Our clinic, and we'll follow those operations for probably the next 2 weeks, but for sure next week. I'm only taking this 1 week at a time. The hospital and ER are fully operational and open. We do have different entrances. The entrance, traditionally, which is our ER entrance, is being used for COVID-19 highly suspected patients or positive patients. So we have a methodology and a way in place there. If it is any other emergency, we will receive you as a patient in our clinic doors in the front. You please call ahead of time so we can prepare to receive you, because that's not a normal way to enter the facility. So we want to make sure that we're notified and we can receive any patients properly and there's no delay in your care. And I really need to say a big thank you to the public in our plea yesterday to stay at home. Our businesses have really stepped up in the last 24 hours. So I want to go through the list of all the businesses and personally thank all of you for offering curbside service or delivery. It is wonderful, and you're helping our community stay safe. I hope I don't miss anybody, but if I did, don't take it personal. I hope I have everyone. Twin Sisters Trading Company, Mar Motor, Mathis, Castle Mountain Grocery and Pharmacy, Branding Iron, Roadhouse, Snooks, Stage Line, Stockman's, The Chicken Shack, Buffalo Girls, Rooney's, and Town Pump. To the best of my knowledge, everyone is offering curbside service for all of their products or services, and the one that is delivering is Castle Mountain Grocery and Pharmacy. So if you do not want to leave your house, which we are urging you to do, please take them up on their delivery services. So there again, I want to thank all of our businesses for helping keep our community safe. The best thing that you can do is stay at home. So Eva, there's a number of questions around COVID and the virus itself. Can you please help our community understand some of those details?
Yes, and I wanted to add one more business I remembered was Smith River. It's Heather Novark.
Custom apparel.
Thank you, Custom Apparel. I know she's done a good job this week too of keeping her doors shut, but being accessible. We did try to get that list beforehand and we missed her, I'm sorry. So a novel coronavirus is a new coronavirus that has not been previously identified. So this is a brand new virus that we are seeing throughout the entire world. This isn't something that people had 15, 20 years ago or even 30, 40 years ago, and they're going to be okay and this one's going to skip them. So it could affect absolutely anybody. It's not the same coronavirus that's circulating around within animals and in other strains that have been out there over the years. This is a brand new one. Can cause a mild illness like a common cold to some people. To our more vulnerable population, our older people, our people with other health issues, it could be a lot more serious. So questions have come up about cleaning products. I do want to refer back to the CDC for a lot of this information. CDC.gov has a lot of things. The very first thing when you pop on CDC.gov right now, it goes right into coronavirus, and you can select that, kind of go through it, and it will answer a lot of your questions that you have. An economical cleaning supply that most of us do have is bleach. You can use bleach 5 tablespoons per gallon of water to clean surfaces. It does need to be changed out every 24 hours. Question comes up a lot about how long is COVID or coronavirus staying on surfaces, and there's a lot of variety of answers out there. The WHO, which is the World Health Organization, says it can live on surfaces for a few hours up to several days. So our recommendation is assume that it could live on surfaces for several days and treat that accordingly. Every day clean and frequently do doorknobs, door handles, light switches, toilet flushers, kitchen counters, kitchen sinks, bathroom sinks, those things, those high traffic areas. Kitchen tables, sometimes that one gets kind of forgotten. One thing we really want to hit home, obviously we want you to stay home if you possibly can, but we also want to hit on the fact that if you are an essential worker, so you are somebody that needs to be out there and helping the public, you still need to take care of yourself as well. If you are starting to feel ill at all with any symptoms or just not quite right, we need you to go home because you are the ones, you're the front line that everybody is seeing. And if we have the public coming into places and we have ill people in those places, we have a lot more chance of spreading this. So we understand that people want to be out there and they want to be helpful, but we need to look out for everybody by if we are ill by any means, we need to stay at home. Okay.
Sheriff John, will you fill us in a little bit on Governor Bullock's shelter-in-place orders?
Certainly. So yesterday, Governor Bullock issued a shelter-in-place order takes effect tonight at midnight, 12:01 a.m. And essentially what that means is if you're an essential employee, go to work. If you're not, stay home. You can still go out, you can go shopping, you can get your essentials, but if you don't have a reason to, don't be out. Stay home, stay safe, wash your hands, and enjoy your family. We're not gonna be out arresting people for not staying home. That's been a question we've had yesterday afternoon and today. Just try to avoid large groups and stay home when you can. Don't go out if you don't have to.
Perfect. Thank you, Sheriff. I know we haven't gotten any questions yet, but I do see that there's a number of people who are having a hard time hearing us. We are recording this on another camera as well, and we will post this video to the YouTube channel and get it out like we have our last couple of videos. So you'll be able to see the audio and the video from there as well. So the floor is open for some questions. We'll try to answer them the best we can, and I'll go over some contact information as we wait for those questions to come in. If you have any information that you would like to stay up to date on, we're keeping the Meagher County Public Health Facebook page, which is what you're watching this on, up to date, as well as Mountain View's website, which is www.mvmc.org. If you have questions, comments, concerns, things you need to talk about, especially if you have an exposure or symptoms, or an exposure and symptoms, call the hospital at 547-3321. Once again, that's 547-3321. And if you have any mental health needs, Jen Hurwitz is taking appointments and doing telehealth visits. You can call her to make an appointment at 547-3888. I urge you to do that, as well as I really urge everyone to follow the shelter-in-place orders in place so we can stay at home and we can make sure that the spread is contained within our community. I want everyone to stay safe. I want our hospital staff and our essential community leaders and first responders to stay safe, because we still have emergencies out there that we need to respond to. So please stay home and stay safe. We still do not have...
Yep, we have one
a
question. Yep. So Dana Shepherd, how long between initial exposure and when you become contagious? And it can be up to 14 days before you start showing symptoms. That's why it's important that if you had an exposure, you want to self-quarantine for 14 days, or at least you want to be very well aware of yourself. You want to make sure if you are feeling ill, if we all can be checking our temperatures. If we start to have a cough, if we start to have a sore throat, we need to stay home and go from there. So it's 2 to 14 days right now is what they're saying. I'm also learning every day things are changing, so that can change. The CDC.gov is usually very good about getting new information out there and updates.
Okay, we have another question, which we kind of covered, is, has everyone that's been exposed by the local case been contacted? Going over the risk factors again, there's high, medium, and low. Those that are high risk factors have been quarantined and for 14 days and or tested. Those that are medium risk have been quarantined, and those that are low risk are not. So if you have not been contacted and asked to be quarantined, you are in the low risk factor category. And like I said earlier, it doesn't mean that risk factor is 0, but it is a low risk. Looks like we have a comment about town pump has not been approved by corporate for curbside service. But I'll still leave them in the thank you category for continuing to take extra steps to clean and disinfect their areas and the pumps, as I understand it. So keep striving to take any steps that you can and help your patrons observe social distancing. So social distancing, for the ease of use, is spread your arms to the person next to you and have them spread their arms. That's the closest that you should be to anyone at any given time. That's the easiest way I can put it for you.
You want to know if the grocery stores are limiting?
Right.
So there is a recommendation and an order within the shelter in place is 10 people maximum in any given area. So when the grocery stores or any of the stores were spoken with as of this morning, they were asked to do 10 people maximum inside their facilities, including the workers. So they're trying to observe that as well as urge people to use social distancing while they're going inside their stores. There again, I'll urge everyone to utilize the curbside service or delivery services available for our community to also keep those essential workers safe. The essential workers are not just county health and the hospital and law enforcement and first responders. At this point in time, our supply chain is an essential need for our community. The grocery stores are essential. So we want their workers to stay safe and healthy as well. Curbside service will help them accomplish that. So I urge you to utilize curbside service and delivery, please.
So the next question is there a preferable day and time to make food bank donations? I don't have a good answer for that one, but we have contacts, and I think we can. Do you have an answer on that one, John?
Yeah, they can drop donations for the food bank, can be dropped off at the sheriff's office 24/7. There's always somebody there. You can just drop them off and leave them at the front lobby of the sheriff's office, and we can get them to the food bank.
So I've seen a couple questions about if our lab is open next week. So our hospital operations, I'll just cover them again quickly. The clinic will have a modified, I'll call it a skeleton crew next week, but we will be offering normal services in our clinic as far as clinic visits with a call ahead first schedule. Our lab and x-ray are going to be operational 24/7, as well as the hospital for inpatient services and our ER. Our ER will have a modified entryway depending on whether or not you're suspected for COVID-19 or not. If you're suspected for COVID-19, you will be received in the normal ER ramp. If you are not, we will receive you at the clinic entrance and take you to the ER. Please call ahead first, because we do not have a camera at that clinic door to buzz you in. So we need to call ahead first. There is a camera at the ER entrance, and so you can go there if you are suspected, but we urge you to call ahead first, please.
So there was also a question about defining what high, medium, or low risk exposure was.
I think we got that, didn't you?
Yeah, well, I'll go into a little bit of the definition. So the definition of a high-risk exposure, someone who's shedding the virus, or we believe at the time of exposure shedding the virus, you have a high propensity to receive the droplets from that patient or during that exposure, and it's for an extended period of time. So, for example, 5 minutes is not an extended period of time, but it doesn't mean that you can't be or get it from the exposure in a very short period of time. So a medium risk would be a little bit more time or long periods of time at a distance, and a low risk is very short periods of time at a distance or a very short period of time like passing a piece of paper back and forth. That would be a low risk exposure.
Rob, I've got one here. I think this fits into the patient one thing. Will those that do have the virus be checked on to make sure that they're staying home and not out and about?
Yes, so we have a new patient monitoring system called Patient One that we are deploying to anyone who is suspected COVID-19 or being tested or being quarantined. That application does have a monitoring system on it that will track location if the patient agrees to it. It'll track your phone so we can track your location. If you are under quarantine, do not leave your home under any circumstance unless you are coming to our ER. Please stay at home. If you are under directed quarantine, do not go anywhere unless you absolutely have to. My best example is you feel like you need to come to our ER.
Yes, absolutely. That is all I'm seeing so far.
Any other questions you can see, Sheriff?
No, I haven't.
Okay.
Somebody had a question if the lab was gonna be open next week.
And he
Yeah,
answered
I
that
got
one.
that
one. Okay.
Yeah.
Yep. So we don't see any more questions at this point in time. What we will do is we will do a video again next week, Monday by 3 p.m. We'll shoot the video, we'll have it out by 5 p.m. on Monday with any updates through the weekend, or if some more questions come up, and we'll try to make sure that those questions get answered. I do see a quick question that came in about hospital masks and supplies. Melissa, why don't you contact me directly and I'll go over those details. At this point in time, we are not asking the community to make any masks for our healthcare providers, but we do have some plans in place that can get spooled up very quickly and make a high number for us if we need to go that route. But at this point in time, we do not need them.
Is the 11 tests including those that have already been tested, or is that 11 that are still available, Sandy Massey?
Okay. Thank you for the question on the tests again. There are, as it stands right now, there are 11 tests available for our community to test possible COVID patients. We have administered 5 tests, of which one was positive. So far, none of the rest have been positive, which is a great sigh of relief for myself and the rest of the staff involved. So we have 11 tests. We are trying to get more. We have indication we may get up to 15 by Wednesday of next week, but until they're received, we're going forward with the fact that we have 11 in hand that we can administer. You will not get a test unless you have exposure and you are symptomatic.
So Katie Bodecker's asking, Rob Brandt, are there any fundraising needs at this time to buy supplies above and beyond what you've budgeted for?
Thank you for that question, Katie. It's uncertain times for everyone, and the hospital's not alone in that. With our operations essentially slowing down to clinic traffic and things of that nature, it is very possible that fundraising for the hospital or for anyone who can't afford groceries because they're out of a job,
Yes.
or for any other reason,
Right.
the food bank, because food bank donations may be down, absolutely, we could use some donations. What I've started the conversation with is our local community foundation, so we'll come forward with more information as soon as they look at their boundaries and what they can receive donations for and what they can give dollars for. So stay tuned for that, and thank you for the question, Katie. All right, that looks like that's all the questions that are here for now. What we'll do is we'll do a video, like I said, again on Monday. If you have questions in the meantime, we'll keep the Meagher County Public Facebook page up to date, as well as Mountain View's website, www.mvmc.org. And if you're in need of any assistance, we will try to get those services pushed out in our fact sheets, as well as within future videos. Thank you for joining, and hang in there and stay safe.
Jackie posted, just said, remember the school is essential, call this number if your students need help, but that's okay, let in the comments, so.